After students analyse the health information on two older people with either a physical disability or with dementia, they're required to complete the clinical case study questions when caring, related to when caring for an older person. So the first question is basically related to the necessary adjustments that we have to make for um, older people with relation to medication. We know that older people tend to take more drugs than younger people because they're more likely to have more than one chronic medical condition. So we know that we need to be careful that they are on multiple medications, which can increase the potential for different drug interactions. We also know that as you get older, your metabolism changes, and this can alter your drug absorption, distribution, and the way you excrete medication. So certainly, as a person ages, the body systems become less effective, and this can cause a change in the way the medications affect our body. So we do need to be mindful about caring for the older person who requires different adjustments to their medications. And in this instance, it's about providing a PRN or, when necessary, medication. So perhaps the person's metabolism slowed down a bit and they're becoming constipated. So that would be a PRN laxative, might be initiated by the registered nurse. So obviously ongoing it would no longer be PRN, or when necessary it would be more of a permanent arrangement. So we were looking at something that has been implemented in the short term. It's quite clear here, why was that particular medication implemented in the short term? What was it called? What did it do? Why did they alter the dose? And what was the reason for the change in that dose? For the next question, describe a strategy you've either developed or implemented to assist with companionship and social inclusion of a resident you've been caring for. We know that companionship and social inclusion is both very important for mental and physical well-being. It gives the resident a sense of purpose. It can help reduce loneliness, as well as providing a feeling of being valued, or maintaining their own social skills. As far as physically, participation in physical activities, along with maintaining sort of healthy habits, is really good for feeling socially included. Also, supporting each other in achieving our goals. So, a person's social interaction really provides that person with a life that is enriched through interacting with their society. So, in this case, with the people that they're living with in the residential aged care facility. What's something that you implemented to help make your resident feel more socially included? For the next question, number 3, reflect on a situation you identified and responded to. Someone was feeling distressed or was showing behaviours that were of concern um, because that person was unable to communicate their symptoms or concerns. So tell us a little bit about the situation that arose where the communication barrier became obvious, how you responded to that particular situation, and perhaps some things you might do differently next time. We know that communication is integral in implementing effective nursing care for the older person. And so we need to be considerate of how we provide appropriate opportunities for communication with people that perhaps have speech impairments or those kinds of things. So, using sign language, communication boards, speaking clearly, concisely, those kinds of things. Question 4 is very much around how this experience has impacted your own values and attitudes towards the older person. So, describing this placement and how it has changed the way you see the older person, and also how it has influenced the way you will be undertaking your role as an enrolled nursing student. So in the previous checklist, where you were asked to assess health information for 2 different people. One was a person with dementia, and the second person was someone that lives with a disability. So we want you to use that information, that health information that you've gathered, to complete the following 2 questions. So this one here is the dementia resident. So summarising the health information that you looked at and how that person presented clinically. And then the nursing interventions that you put in place after you discussed that person's needs with the registered nurse you're working with or enrolled nurse. For the same, for the person that had the disability, we want you to also summarise the health information you collected and then provide the nursing interventions that you recommended. And that's all that you need to do for the clinical case studies. This page here is purely where the case studies will be assessed. So where the clinical facilitator will sign off that you were deemed satisfactory. You don't need to do anything on this page. That is for the facilitator to sign you off. You will get some feedback and we ask that you provide a response.